Hi, I'm Jill Stokold with The Advocate. I'm here today at the Baton Rouge Clinic, and I'm talking to Dr. Everett Bonner, who is a breast specialist and
Correct.
a surgical oncologist.
That's correct. Yeah.
So, talk to me about this.
Louisiana specifically is a hot spot for breast cancer. In fact, in the capital region, we have 10 persons higher than the national average and the state average per 100,000. Louisiana, which is interesting, is third or fourth in the nation for screenings. We're doing a good job getting the message out there, especially around October. The bad news is that we're third or fourth in the death rate. So there's a little bit disparity between getting your screening, because we always say early detection saves lives. It's not transferring over into the death rate in Louisiana patients.
Wow, that is not great news, but I'm glad that we have
That's a challenge.
people
I know,
like
I
you.
know.
It is kind of alarming as to, like you said, the disparity there. So, speaking of screenings,
Yes.
what is like the goal? I'm sure there's not just one standard, but what is the gold standard for women?
What we like to do is tell patients, start at 40, but you know what? Talk to a breast surgeon, talk to your physician, have that conversation, because you may have to be screened sooner. We say that if you have a relative that was diagnosed at an early age in their 40s or even their 30s, you should do your mammograms 10 years prior to the youngest person in your family who's had breast cancer. But if someone comes in and said, oh, my great aunt, it's not as important. It doesn't factor really into the big risk factor. But if it's a great aunt, but you also have an aunt or you have a mother, you start adding those together, that increases the percent of the risk factor.
Right. So you mentioned a couple of things about weight and smoking and
Mhm.
alcohol consumption. Are there other things that just on your own you can do to kind of prevent?
So one of the things they say, it's hard in Louisiana, 3 to 4 drinks a week. Anything more than that can increase a risk factor. Smoking is always a risk factor. It's a risk factor for all cancers. Weight, and the reason why weight's very important. People don't realize this. They only know that my ovaries make estrogens. Oh, if I'm through menopause, I don't have to worry about it anymore. Well, the body has evolved over the years, and there's a peripheral conversion of body fats to estrogens. So the body has found a way to create estrogens through the body fats. And so women who are overweight or have excess weight are also increasing their estrogens, which puts them at a risk factor, because estrogens are also a risk factor for breast cancer.
Wow.
I know. It's like, gee,
So,
thanks.
during your time that you've been practicing, what kind of advancements have you seen in, like, whether it's screening or treatment or you name it?
A lot of people worry about the radiation aspect of that. If you don't realize this, 1 week of normal living in this country, you have more radiation than if you just did one mammogram.
Oh, wow.
Yeah, so that's something interesting. Just daily life with all the radio waves that are going on, the cell phones and microwaves and everything that we're exposed to. 1 week of normal living is the equivalent of the radiation exposure that you get from a mammogram. So that's not a factor, but it's the education of that. It's trying to break down that fear. The other fear is like, oh, I don't want to have a mammogram because I don't want to know if I have breast cancer. Well, then it's too late. We can't have early interventions because, like we said, early intervention does save lives. We're getting better reads or getting better results in early detection because of the advancements, at least in the radiology part of that. Then we have ultrasounds and MRIs. And so MRIs have really helped out with some of those densities and finding small cancers. There are some cancers that don't show up well on mammogram, or sometimes not at all. 15% of breast cancers don't show up on a mammogram. It's a physical exam, or an MRI can pick it up. So knowing your breast density, knowing your family history, should I get the more advanced imaging in addition to, that's one key, in addition to the mammogram. And one thing people always forget, a normal mammogram doesn't mean that you're normal. A physical exam is always important. In fact, you probably remember a lot of people who have breast cancer will get a lot of their lymph nodes removed. We don't have to actually remove all the lymph nodes anymore. We can use target-directed radiation therapy, and will take the place of big axillary surgery, which increases the risk of one having lymphedema.
I was about to say it,
And
that the
and then
lymphedema.
and then the icing on the cake is the chemotherapy. We still have what we call the shotgun blanket chemotherapy, which we give a lot of women, but now we have target-directed chemotherapy, immunotherapies. In certain cancers, we have medicines that work directly for that type of cancer. And so that's revolutionized breast cancer. If you have early detection, stage 1, stage 2 breast cancer, it's high 90s, 98, 99% survival rate. If you catch a cancer in a stage 0, it's almost 100% survivability. So that's why the mammograms are key, early detection, because we can catch cancers at an early stage and you have a high 90% survival rate, which is almost unheard of for a lot of cancers.
Right, absolutely. Wow. So, I mean, what are, like your tip, and I guess there isn't a typical treatment plan for women.
So here at the Baton Rouge Clinic, what usually will happen is they'll get an abdominal mammogram. The radiologist will call me directly and say, hey, I have one of the classifications that needs a biopsy. So the patient will get scheduled by my nurse. I do my own biopsy. And then we usually get the results back in 3 to 5 days. And I usually call the patients first. They come in, we discuss that. They may need MRIs, they need PET scans, they may need further imaging. And then the process starts. Do we need chemo first? Do we need surgery first? And then we kind of make that decision, what goes first. And then what's going to be the follow-up, what we call adjuvant treatment. So anything that's done before surgery is called neoadjuvant. Anything after surgery is called adjuvant. And then we come up with a surveillance plan. Okay, you've had this cancer, you've had this treatment, now we're going to go into survival mode. And do you need mammograms every 6 months? How often do we do screening? And this is going to be our plan. I think really the most important thing is not only when you get that cancer diagnosis, is make sure that you're comfortable with the team that you're with. Because it's a journey, and you got to make sure that person's going to take you through that journey is the one that's going to bring you to the finish line. Not all personalities get along well. As great as I think I am,
Sure.
sometimes there's some conflict. The only time I've ever had an experience where the personality didn't work, one person said I was too nice, and they wanted somebody to be meaner and stronger and take the bull by the horns. Like, well, then that's not me, because I'm more the touchy-feely, empathetic, and to get you there. So that was kind of interesting. So that wasn't the right
I
personality.
would want you. Not that I want
I
you,
know.
but I would want
in
you.
20 years, that was the only one I was like, oh, I'm too nice. Like, well, I'm not changing.
Right.
I want to stay me.
But that's a great point, is that
Yeah.
people can educate themselves and have a choice.
Absolutely.
And it's got to be the right fit, because you're in it together for a minute.
You're in it for the long term.
Yeah.
It is. Especially with the breast surgeon, it's a lifelong relationship. It's almost like a marriage. We're here to the end.
I like it.
Yeah.
I like it. Thank you so much for
You're so
your
welcome.
time
Thank you.
today.
I appreciate it.
I really appreciate it. Guys, don't forget, for all of your imaging services, your need, hopefully you won't ever need Dr. Bonner services, but if you do, don't forget, support local and come to the Baton Rouge Clinic.